Hi everyone, my name's Talena. I'm from the Vancouver area of British Columbia in Canada. I'm going to be posting videos about bariatric surgery, specifically in relation to BC, Canada. Um, First off, disclaimer, do your own research and talk to professionals. I'm here to provide personal experience, opinion. Some of the information is accurate. I'm like a guiding post, as it were. I'm just adding this content because my research, I found a lot of American content, which is great. There's nothing wrong with it, but there are some significant differences between the States and BC, Canada, and I'm just going to go over those in this videos first. I'll be doing other videos in the future that will be more, will have their own topics. Anyway, so this one I'm going to talk about pursuing bariatric surgery in British Columbia. First of all, it's good to understand that in Canada, if you didn't already know, because the federal government funds medical services for the country, they provide each province with a budget, and each province is then responsible for doling out funding to specific services in their province. So each province will have different funding amounts for different services. So in this case, just some quick FYI, Quebec has decided to fund a couple thousand, I think, don't quote me on that number, surgeries per year for bariatrics, whereas BC only funds, I think it's 425 beds per year, and that number is split evenly between Victoria and Vancouver. So do the math, add in population, add in the fact that people from Prince George and the Kootenays come down to Vancouver for their surgeries and use up the half of the 425. There's nothing wrong with you guys coming down here. It's all part of the deal. I'm just pointing out that one of the reasons why BC has such a huge wait list is because we have such low funding for surgeries. So moving on, there's two ways, other than paying for surgery yourself or going to Mexico and doing a medical vacation or going to the States. There's two ways of pursuing bariatric surgery in BC. So one is going to your GP and having them send in a referral to a bariatric surgeon. So there's a couple of different places you can do that. The main place to go, though, is the Richmond Metabolic and Bariatric Center. The people that I met there that did it that way, going through their GP and having the referral sent straight to them, they ended up waiting 2 to 2.5 years before they got the phone call for an orientation. So the way that I ended up getting into Richmond Metabolic Center was I found out about a program called Medical Weight Management Center. It's in Coquitlam, British Columbia, and you can go, this is their program manual, so you can go to their website, you can see it there, medweight.ca, and you can download their referral form. You fill it out, take it to your GP, they finish filling it out, and then they fax it to Medical Weight Management Center. And so I'm just going to tell you a little bit about Medical Weight Management Center. So it is run by Dr. Michael Lyon. He's a diplomat of the American Board of Obesity Medicine. He is a clinical instructor at the Faculty of Medicine, Department of Family Practice at University of British Columbia. He has a team of physicians, including internal medicine specialists, nephrology, hospitalists, general family practice, endocrinologists, nutritionists, you name it. They have many office assistants, and who else? Obesity medicine assistants. They're great. They often run the education sessions. They're a really great resource to tap into when you're there. So you get the referral sent to Medical Weight Management Center. And it didn't take me long to hear back from them. So I had mine sent in January 2018. By February, I was going for my intake assessment there. Previous to that, they had sent me forms to go get a bunch of blood work done. So they run through you with a fine-tooth comb to make sure and find out what's going on with you in all ways, other than what's visibly obvious that you're overweight. So because obesity is caused by a number of factors, it needs to be approached from a multidisciplinary way and a holistic way. So they look at things from, social aspects to psychosocial to economics, to your barriers that are preventing you from maybe eating healthy or taking care of yourself. They look at stress. So a lot of the programs or education sessions, which they call modules, are geared to providing education around these topics. And there's lots of them. Anyway, so you go for your intake assessment, and then the first thing that you need to do once you're in the program is take an 8-week module called Core. And each week they cover a different topic. Those topics are often then individual modules later on down the road that you can take that then kind of like focus more on that. So for example, they do talk about stress management in Core. It's only, I think, one night, but then there's a stress management module that's 8 weeks that you can take that really delves into how to deal with stress and manage your stress and changing your thinking and your mindset. They talk about mental health in Core. You can take an 8-week cognitive behavioral therapy course with regards to mental health. That's another 8 module that you can take. So you can see there's lots of different things. They have like a meal planning and nutrition module, and so on and so forth. So how I got to the bariatric one is they have a bariatric module, and that's 4 weeks. Dr. Michael Lyon teaches each session once a week. You go, and he teaches you everything about bariatric surgery so you can make an informed decision if you want to pursue bariatric surgery, if that's right for you. If you're on the fence or you're not sure, you just want to, maybe he's going to teach me something I don't already know. So once you go to that, at the end, if you decide you would like to pursue bariatric surgery, please email this person. So then you email this specific individual, and then they connect you with a nutritionist. You need to be food journaling, you need to be exercising, getting lots of water. They encourage 8 to 10 cups of water a day. And there's a reason for this. It's about developing habits that you're going to want after your bariatric surgery. Anyway, so you do the bariatric stream, you meet with your nutritionist, you're doing your journaling, and then you meet with the nutritionist again. They just see that you're still on the right track. And then once they're satisfied, then you meet with an internal medicine specialist who looks at your medical stuff and goes, okay, things are looking good. This is improving for you. That's improving for you. You're medically stable. I'm going to clear you for surgery. If you end up having it, I'm good. You're good to go. So then once you get all that done, MWM puts your package together, and they send that package as a referral to Richmond Metabolic Bariatric Center. So my package was put together at the beginning of December. I was patient and waited for the Christmas season because nothing ever gets done at Christmas time. Just don't even bother. Just get it out of your head. If you're in the same situation that I was, because you're just going to stress yourself out, just enjoy your Christmas. Enjoy maybe Christmas dinner as you've had it your entire life one last time. It's not like you won't have Christmas dinner again. It'll just be a little different for you in your future. So come beginning of January, I gave them a ring because I hadn't heard anything yet. So I waited till after the new year started, like second week of January. And, did you get my referral? And they're like, yeah, okay, we've got an orientation session January 24th, do you want to come? I'm like, yep, sure. So I went. And today is March 22nd, and my surgery is March 26th. So in 4 days. So much faster than had I had my GP send the referral to our MBC, Richmond Metabolic Bariatric Center. Waited 2 to 2.5 years, like everyone that was in my orientation session that went that route had waited. And there was probably, I'd say 75% of them went that route, and there was just a couple of us that had gone through MWM. But once you get into RMBC, if you haven't done MWM, you still have to do a bunch of the education on nutrition, mental health, stress management. You have to do all that stuff that MWM does with you, with Richmond, before you can do your surgery. So then that takes even more time. So you could be looking at 3+ years before you have your surgery from the time that you met with your GP and had that first referral sent in. So those are the two common ways of going about the surgery or pursuing the surgery. The one thing that I liked about MWM, I just want to say, it's not all about having bariatric surgery. I just want to say this because they provide you with so much education that even if you went into it thinking, yep, I'm going to have bariatric surgery, you might find that what they are teaching you is what you're able to do. That's what's working for you. You're finding that you're getting healthier. You're able to do the meal planning and all of that stuff. And I mean, I did that too, but I'm still not seeing the results in the weight loss that I wanted. So I've continued and pursued the bariatric surgery. Some people, they do the bariatric stream, they get all the education, they're like, you know what, that's just not for me. I thought it might be, but I'm just not willing to do that. Because I'll tell you right now, bariatric surgery is serious. It's considered a major surgery. The reason why Canada funds this surgery, and you have to have the education to even be offered the funding, basically the 13 grand, I think I popped that in there earlier, is the taxpayers are paying for that. They want successful patients. They don't want someone that just went, they're in their early 20s, they haven't finished growing up, because our brain doesn't stop developing till we're 25, and even then we haven't had life experiences, we haven't learned a lot. They're just like, I got the money, or mommy and daddy are going to pay for it, or I'll just get a loan. And they go to the States, or they get a medical vacation, and they go and they just pay for it. They go down, they have their appointment, they're down there for a week, they come back, they don't have the education. Who knows how much research they did before? Who knows how much education they provided themselves with about what is required to maintain the weight loss after the surgery, because bariatric surgery is not the easy way out. If anything, it's just as hard, if not harder, than not having it and grinding at the gym or walking an hour every day, eating super clean, being disciplined, meal planning right, left, and center. You're still doing all that. But the thing with the bariatric surgery is that afterwards, your biology has been physically altered, and if you don't know how to treat that new stomach and that new digestive system, you will gain the weight back without fail every time. There's no way around it. So don't kid yourself for a second that you're gonna have a gastric bypass or a sleeve. Those are the two most common surgeries in BC. There is a third one that was just recently approved in December of 2018. I won't be talking about it in any of my videos because it's used for severe obese situations, like dire stuff. But the Roux-en-Y, gastric bypass, and the sleeve are the two gold standard surgeries that are done in Canada. Lap band is obsolete, and the mini gastric bypass, they don't even know about it here because it's not considered good enough. science or medicine. Anyway, it's not the easy road out. It's going to take you time of wrapping your head around it if you want to maintain success afterwards. Because if you've gone through all of this, you've had this major surgery, and then you just blow it because you think, oh, I've had this I can eat like whatever I want after, which is a huge misconception. You're gonna, within a year of having the surgery, yeah, you'll lose weight in that first year, but you're gonna start gaining it back, and it'll be very hard to turn that clock back around again if you finally get your head in the right space. So that's why there's minimal funding for these surgeries in Canada, and it's not automatically paid for like a gallbladder surgery is. There's no questions asked. Your gallbladder's full of stones and it's not working, it's covered. There's nothing about that, right? With bariatric surgery, very different. It is an elective surgery, but funded based on things. So, quick caveat, you need to meet certain requirements, physical and all these other things, emotional, educational, to receive bariatric surgery paid for by the province of BC. Anywho, I'll post some links for the websites, or you can just Google them yourself: Medical Weight Management Center and Richmond Metabolic and Bariatric Center, and do your research. I'm just here to help and offer my experience. I'll be posting more videos coming up soon on different topics, not necessarily in any specific orders. And then once I have my surgery, I'll try to post videos maybe weekly. I don't know. I'm not really a YouTuber. This is new to me. So I'm sorry if this video is maybe rambly. I'm trying to give you as much information that I can that's important to make the decision. Okay? So that is Persuing Bariatric Surgery in British Columbia, Canada. Okay, peace guys.